Welcome to Health Yeah.
My name is Porpo. I'm a sophomore at Hoover High School, and today I'm excited to be here with my co-host to discuss an important topic, mental health and the stigma surrounding it. But before we get into it, I'd like to pass it on over to my co-host, who'll be introducing themselves and sharing a little bit more about our project.
Hi, I'm Natalia Marquez. I attend North High School, and I'm a sophomore.
Hi, my name is Meredith Gentry, and I'm a junior at Roosevelt High School. Natalia Porpo and I are all a part of Primary Healthcare Student Advisory Council, and the purpose of our council is to help primary healthcare provide the best possible care to people our age within the Des Moines Public School District, promote primary healthcare school-based clinics, and let our friends and peers know about the opportunities that are available to them.
Our council, comprised of students from DMPS high schools, has chosen to create a podcast called Health Yeah, dedicated to exploring mental health. We'd like to thank Addie and the Polk County Health Department for allowing us to take over the By the Numbers podcast. In this episode, we'll dive into the stigma that so often surrounds mental health and discuss ways to break down these barriers.
First, what do we mean by stigma? According to the Center of Addiction and Mental Health, stigma in mental health refers to the negative attitudes, beliefs, and stereotypes directed at individuals with mental health conditions. It can manifest or form in different ways, such as structural, cultural, and public stigma.
According to psychiatry.com, structural stigma involves policies of government and organizations that limit opportunities for people with mental health conditions. This includes lower funding for mental health research or fewer mental health services, especially within schools. School resource officers, dress codes, testing environments, and even restrictions on gender-affirming bathrooms can all negatively affect students' mental health.
Culture shapes the way we perceive mental illness and people living with mental health conditions. Culture also influences whether or where people seek treatment. They cope in their social supports. Cultural viewpoint may become some of the biggest barriers to health and well-being. It can prevent people from sharing struggles and asking for help. We found an example of cultural stigma on womenshealth.gov, shared by an Indian woman who is also a mental health advocate. She shared that, for example, within the Indian culture, mental illness is often perceived as a curse, punishment for past sins, or possession by demonic spirits. It is also perceived as a black mark on the individual and their entire family. So my family and I, like many others, kept my struggle a secret. My treatment included priests, physicians, even as I was prescribed antidepressants, shock treatment, and psychotherapy. A priest was invited to my home to exorcise the demon in me. This is not unique to Indian culture. Many cultures have similar beliefs that somehow a mental illness is disgraceful and something the individual brought on themselves.
Public stigmas, such as stigmas in or at school, are when your peers, teachers, or classes have a negative influence or impact on how you think towards your mental health. An example of this could be when your peers believe that your mental health doesn't matter as much, or that some negative conditions, such as depression, become normalized, and these stigmas may lead to students not wanting to reach out or speak out about their mental health at all. And in today's show, we'll be exploring public stigma and its impact on students' mental health.
Today, we are excited to welcome Dr. Stacy Fossenberg to discuss mental health stigma and its impact on young people. Dr. Fossenberg, a licensed psychologist and behavioral health consultant at Primary Healthcare's Eastside Clinic, brings extensive experience from various medical and mental settings, including community health, private practice, and hospital clinics.
Dr. Fossenberg earned her PhD in counseling psychology from the University of Iowa, focusing on children and adolescents. She further specialized in trauma, substance use disorder, and working with trans and gender diverse youth during her training at the University of New Mexico's Health Science Centers and Children's Hospital, Los Angeles.
Currently, she collaborates with patients of all ages at primary healthcare, addressing mental health issues and conducting psychological assignments for ADHD, learning disabilities, and cognitive concerns. Dr. Fossenberg is dedicated to making mental health care more accessible and reducing stigma, empowering individuals to seek support. Welcome, Dr. Fossenberg.
Thank you so much. I'm excited to be here.
Thank you for joining our podcast.
All right. The first question, how does stigma affect the way youth perceive their own struggles?
This is it's a really interesting question. And I'm going to cheat a little bit and ask you all how you think stigma, you've done so much research on this. How do you think stigma affects the way y'all view your own mental health care?
I feel like it kind of takes away from the way that students address their own mental health. I feel like it causes at least youth to be more apprehensive when talking about it. I feel like recently, at least like with post-COVID, I think having like stigma towards mental health definitely was broken down, just because I think there was more struggle with mental health throughout that COVID period, but I still feel as though people are even like apprehensive to talk about it, or almost like ashamed to address their mental health issues.
For me, I think that stigma, like, I guess holds back youth from being able to go onto the path of, like, being free and willing to speak up and do things, like, without feeling ashamed of themselves. Because sometimes, like, depression and stuff, people may think, like, oh, I'm weak. And, like, nowadays in society, like, as, like, a teenager and stuff, you can't be seen as weak, or else, you know, I don't know. But either way, yeah, stigma really holds back people from, stuff.
Mm-hmm.
I agree with Meredith and Claire Poe. For me, I mean, it doesn't really affect me because I have really close people with me that I can talk to it about. But for other people, like my friends or people that I'm close with, they say it's a hard time to be able to talk to their parents or friends, because their friends might take it as like them being weak.
Mm-hmm.
So.
Yeah, so I hear like weakness is a big thing, not being seen as weak, or wanting to be seen as weak. And I also love, Meredith, what you said about how COVID really impacted mental health. One of the things that we know from the research, and one of the biggest trends in mental health during COVID, was actually in adolescent mental health. And we saw a huge decline because, y'all are at an age where you're in like one of the most important periods of brain development, of social and identity development. Right. And when you're stuck at home and not able to interact, it's different over the screen. I think we're all nodding. It's very different over the screen. So there are all these different pieces that impact mental health and stigma. And after COVID, I don't know that we've seen some improvements, as many of us have like gone back to workplaces or school places, but it's not quite returned to that level of interaction and connection that we had prior to COVID.
Mm-hmm. Do you feel like it's kind of affected the way that we even know how to like have social interactions with other people, like even just like at school, the way that like we address like conversations or being like out in public?
My initial response is, yeah, how could it
right.
not? Like, and I'm aging myself a bit because I was not in school during COVID, but I also grew up without a lot of social media too. And so most of my connection was like one-on-one in person. Yeah. I had like MSN Messenger and AIM and all of these things that are going to definitely date me. But the primary interaction was all in person. And then with, during periods where like summer breaks or winter breaks, even though you're not at school, you're still connecting with people throughout the school year. And COVID just completely changed that for a lot of folks.
Yeah.
How could these things not interact when we're so wired for connection and human relationships?
Right.
No.
Okay, I'm going to say the next question. What roles do peers play in either reinforcing or breaking down mental health stigma among youth?
I think peers and friends can play such a huge role in both reinforcing and breaking down mental health stigma, because, I mean, your peers are the people you go to when your friends are the people you go to when you're struggling. I think for so many of us, like, your friends are the first people you talk to. Like, hey, am I crazy? Is something going on here? Do I need to check myself? And so if that person says back to you, yeah, the things that you're thinking or feeling are totally wrong, or this is a really bad thing to think or feel, that's reinforcing mental health stigma. Or you shouldn't be talking about this. It's not okay for us to talk about things like this. That's going to continue reinforcing those stigmas. But instead, if someone comes to you with an issue and says, hey, I'm really struggling with these thoughts I've been having or with how I see myself, and they say, I may not feel the same, but I do know that I really care about you and I want to know more about how I can help support you and how I can connect with you. I want to understand. That feels very different.
Yeah.
But how do you all feel about that?
I feel like I would agree that maybe you don't really know how to initially react if one of your peers comes to you with struggles they've been having or thoughts that they may have been having, because maybe you don't relate. And so I think that in itself creates a stigma of like, oh, we just aren't going to talk about it because you don't know how, like, the effect that it may have on your friendship or how they may now perceive you. You don't want to be perceived as having like an issue or something that's wrong with you. So I feel like people, even if you are close, maybe you don't talk about it because you don't want it to change that relationship.
That's scary.
Yeah.
Like to think about the idea that relationship might change, that friendship might change because you're introducing something new into this.
Right.
Yeah.
I agree with Meredith. At least for me, sometimes I'm gonna use me for an example. I like my friends will text me or they'll say like I feel this type of way, or even like my cousins or family, but I don't personally like know how they actually feel because I don't feel the same way. But I will always talk to them and make sure they feel comfortable talking to me because I just like people to feel safe around me and stuff like that.
I love that. And that's you've brought up your family a couple of times, and I love that that's a great source of support for you. And what you said, like, even if I don't feel the same way, like, okay, I'm not struggling with the thing you're struggling with, but I still want to listen. I still want to provide that support. It's an incredible thing, and that's really powerful. That goes back to what we were talking about with human connection. And I don't have to experience the same things as you have to still want to understand and support you.
Yeah.
Right. Changing the topic a little bit, do you think the rise in mental health content on platforms like TikTok and Instagram has been helpful or harmful towards mental health? Kind of circling back to that previous question.
I have such complicated feelings about TikTok and Instagram and social media. Again, because I grew up in a world with Messenger and Ask Jeeves. I have on the one hand, social media, regardless of the platform, has been so great for getting more information out there. Like, I have patients come in and talk with me all the time about, hey, I saw that this thing on social media that said, hey, this could be a symptom of ADHD, or this could be a symptom of depression. And people who would not have typically come in and noticed that or known that these were symptoms, they come in and talk about it more regularly because that information is out there and more easily accessible. That's something I love. I also love, as I think many of us do, cute cat videos.
Yes.
ASMR. All of these really breaks from reality, shorts, things that help us escape, help us cope. There's nothing wrong with things like that. Yeah. However, on the other side is a lot of misinformation, especially about things related to mental health. A lot of people relying really exclusively on TikTok or Instagram or Reels that they see to completely understand their diagnoses or what may be going on for them.
Right.
And most TikTok influencers are not, in fact, qualified mental health professionals or health professionals even. Yeah. And so it's a balance, right? You can get information, but not completely rely exclusively on the information you get on social media. So I don't know if I would say it's more helpful or harmful. I think, as with many things, it's a balance.
Right.
There's some
Yeah.
of both. And it also depends on how you use it.
Mm-hmm.
I saw all of you nod at that. I wonder.
I know, like, at least for me, with, like, the last week and everyone was saying, like, TikTok's gonna get banned. And at least for me, I was almost having feelings of, like, total withdrawal. Like, I've become so addicted to TikTok that now, like, that it's going to be gone. I was like, what am I gonna do? Like, what's next? Like, no TikTok, no scrolling for hours before bed, just like things like that. And then you kind of realize how reliant you've become on social media, and even just like you said earlier, doing like your research on TikTok. Like, if I don't know something, rather than even going to Safari, I go to TikTok.
Yeah.
And so that there's just such a reliance on social media, and I know, like, at least for me, there's also such a comparison aspect on social media, like with body image and like people just with like unrealistic expectations that social media creates.
Yeah.
Yeah, I agree with Meredith. At least, like, for me, sometimes I look at girls that look this way, and I'm like, and people, I feel like a lot of people do that, and it's not, like, I think it's not okay, because you should love yourself however you are. At least that's what my mom tells me. But, like, it's not right for people to compare themselves, especially, like, if somebody looks just, like, completely different. Like,
Right.
I love what you're saying about that, because in psychology, there's this idea of schemas. And basically what that means is I know what a dog is because I've seen a lot of dogs. Like, and so this is what a dog is in my mind. If I see a chair, I know that's not a dog, right?
mm-hmm.
And the same can go for like what we see as the typical 15-year-old, like what a 15-year-old girl looks like. Social media can literally change the way that we see or expect how other people should look. I'm using air quotes here.
Yeah.
How they should or should not look. Like, it's literally changing our brains to have a different schema, a different view of how this could be. And actually, there's also a lot of research to show that constant scrolling, to go back to what Meredith said, more than 3 hours of scrolling a day has been shown to, like, dramatically worsen mental health symptoms, especially for people who were already prone to mental health concerns like depression or anxiety. It's exponentially more likely to worsen those. So to hear like the withdrawal pieces, those are very real fears and also have very real repercussions that maybe we didn't realize until it was going to be taken away. Yeah.
So what is it for me, like, back to like the scrolling, when I heard that TikTok was going to get banned, I tried my best to save as many videos as I could.
Yeah.
But what is it, right after that, when it was officially banned, I was just like sitting in my bed like, wow, I actually have a lot of free time now. And
Yes.
I was thinking of like hobbies to pick up. Was like, maybe I can try picking back up like knitting again, because my mom, oh my gosh, she wanted me to do it so bad, but I was like, no thank you. So yeah, I might pick it back up, and then it's back and I'm like lazing around again. But at the same time, like on social media, there's like two sides I've seen. Like, like the body, like what you're talking about, like I've seen body positivity and I've seen body, like the negativity parts. And I've been on both sides before. But the thing is, I really don't care, because, hey, you are what you are. I'm not going to say anything. And I've just been on so many sides, and it honestly differs for people. Some people, they get like impacted because they want to be so like a certain way, but some people they don't, because they believe in like that they're good enough, like they're fine, they're confident. So yeah, it just depends on whoever.
Yeah, that kind of goes back to, like you were saying, like how we use it matters. Because if my algorithm is full of, people who look a certain way or people who behave a certain way, that's going to affect the way that I use it. Affects the way I use social media, and then it affects the way I see and feel. I see and feel about myself.
Right.
All right. Do you think substance use disorder is considered a mental health condition? Why or why not?
Yes, unequivocally yes. So in my field, we we use the diagnostic and statistical manual. Please don't remember that. That's not going to be important later. But this is what we use. It has to diagnose people. It has all of the diagnostic criteria someone needs to qualify for a mental health disorder. And substance use is listed in there of a variety of different types. So we've got everything from alcohol to stimulants to marijuana, loads and loads of substance use disorders. They're considered mental health conditions because, well, it's, as with many concerns and conditions in the DSM, it's both a biological piece as well as like a mental health, how we think about things piece. And addictions or substance use disorders in particular are a very strong combination of both of those. So we know that when someone uses substances regularly, literally their brain chemistry and their neurons, the way that their brain processes information changes. It's not that they're not strong enough. It's not that they're not trying hard enough. Literally their brain chemistry has changed. Yeah. So this makes it a mental health condition that we can utilize lots of different tools to help treat. Things like at primary healthcare, we have a medication-assisted treatment program. We have lots of different healthcare providers who are really skilled in talking with people about behavioral changes they can make, but absolutely a mental health condition.
Okay. My next question is, why do you think it's difficult for youth to seek mental health services? What are the barriers the youth are facing right now?
As much as I wish I would still qualify under the category of youth, I think I passed that. What do you all think? I think this is a really good one to get your input on. What are some of the biggest barriers?
Maybe.
No, you can go.
Maybe they're too scared to talk about how they feel. They feel like they're gonna get judged, especially like in their culture. Maybe asking their parents for help or anybody actually, or thinking that if they tell their friends, they're gonna get judged. At least that's the biggest thing, getting judged.
Mm-hmm. That's come up quite a bit, this idea of getting judged. And it's a very real fear, and one that our brains create because, okay, so your brains exist entirely to keep you alive and keep you from experiencing pain. Right. And that's not just physical pain, like, hey, don't touch that hot stove because then I'm going to make your hand hurt, but also emotional pain. Like, I know that when I have to give a presentation in front of the class, I know my heart races and I feel like I'm going to throw up because my brain is telling me that that's potential emotional pain. And I think this judgment piece kind of comes back to this idea of emotional pain. We're worried that if we introduce something new, like Meredith was talking about, if we introduce something new to the relationship, there's the possibility that we'll experience pain, whether that pain is embarrassment or rejection or judgment, and your brain telling you, this might not be okay to share, is your brain trying to protect you from something that it sees as potentially painful. Mm-hmm. Is that a weird way to think about that? I'm curious what you all think.
Yeah,
a little bit.
Yeah. I think kind of like to add on to that, or to what Natalia had said, I feel like there's a thought that going along with being judged, that even like within yourself, that if you advocate that you have something going on, like with like a mental health like issue, that you feel like that will coincide with like, oh, there's something wrong with me, or oh, I'm not right, like something needs to be fixed, and I don't want to say that because I don't want that to be true, and so people just, I feel like, don't talk about it.
Mm-hmm. Kind of like if I say it out loud, it makes it real.
Right.
Yeah.
Right.
So if I just avoid it, maybe it isn't true.
Yeah.
Yeah. Yeah.
I was going to say a little bit earlier that, like, the question being, why do you think it is difficult for youth to seek mental health services? If, like, any of my friends just asked me this, I would say so broadly, oh, it's because of stigma. But, like, here now, I would probably say, like, in detail, because stigma is the idea that, like, it's something that holds people back from doing something or, like, reaching out for help. because of the idea of being judged. Yeah, what is it? Yeah, because they feel like nervous about being judged by their peers, family members. Of course, you probably have already said that, but like I'm thinking about me. My family, they're not very judgy, but at the same time, they kind of are. Cause like my grandma and stuff, like she's scared to go to the hospital because of her old age and stuff, and like she's right now in Thailand and she has to go to the hospital often, and she doesn't really enjoy doing that because she doesn't like being seen as weak and stuff, and like the doctors, and she just doesn't like that. But of course, my family, they keep urging her to go because they're like worried for her, but she doesn't want to because of all the stigma and like the norms she's been surrounded by in her life.
Mm-hmm.
So yeah, but then for my youth and stuff, because my mom has taught, or like all my aunts have taught our children, or all my cousins at least, to like be strong and stuff and to not show weakness or whatever, that just makes them probably like not want to go to or reach out to anyone at all about that stuff.
Blurpa, what amazing examples those are of how you use the word norms, which phenomenal. Love that as a psychologist. You can use norms more regularly if you like. When like it's such also a great representation of how these internal messages we have are so powerful, and they come from lots of different places. You all had the most beautiful definitions of stigma of a variety of different kinds when we started this podcast. And also, I think to simplify everything that you all said, stigma is that voice in your head that says, I'm crazy, I'm nuts, I'm weak, I'm being too sensitive, this stuff doesn't matter. It's literally that voice you hear that tells you not to say something and puts up those walls.
Like like the angel on the shoulder, and the devil is just like the devil like speaking over the angel the entire time.
Yeah.
Basically, kind of.
Screaming sometimes.
Yeah.
So I think we have just run out of time, but to kind of wrap up, we first of all want to thank you for joining us on our podcast with all of your knowledge on this topic of stigma. It was a pleasure to talk to you and to meet you. And we appreciate the work that you do to make these mental health resources accessible to students of our age. As we wrap up, we want to remember that breaking the stigma doesn't happen overnight. However, it can only happen if we work together and advocate for our issues, for our own mental health. And if you're struggling with mental health, know that you aren't alone, and there are always people that you can reach out to, and it's a sign of strength and not weakness. For our listeners, we challenge you to go out of your comfort zone, educate yourself, advocate for mental health resources, and speak up against stigma where you see it present. Let's work together to create a safe space where you can seek the support, where people can seek the support that they deserve. For more information about primary health care and their Student Advisory Council, check out our website at phciowa.org/School Advisory Council. Again, special thanks to Addie and the Polk County Health Department for letting us take over your platform for this episode. Thank you for listening, and we'll see you next time on Health Yeah!